Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. I'm sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Heather, who is a family nurse practitioner. She is working PRN at the VA, but she operates a functional medicine practice full-time predominantly. She started her practice about 2 to 3 years ago, and it states it's doing good with business beginning to really pick up. She's needing assistance with developing protocols, creating packages, and narrowing down the services she should be offering. Hey, Heather, how are you?
I'm doing great, Justin. How are you today?
I'm doing good. Thanks for hopping on here. So tell us about yourself. How long have you been a nurse practitioner for, and what sorts of things you've been doing?
Okay, so I've been a nurse practitioner for quite a while. I went to University of Florida and I graduated in 2007 and I got certified in 2008. So it's about 15 and a half years. I'd always really liked focusing on holistic type medicine. Even when I first started, I worked in oncology for a long time, but I always found myself kind of like wondering why things happened, not just how do we treat them, how do we treat a disease or a diagnosis, but why did it happen? How could we prevent it from happening again? And so I switched to aesthetics, which is a huge pivot in 2017. And I loved doing it. I loved helping people. I loved making them feel better about themselves. But again, I noticed we just weren't treating root causes. We were kind of making the surface look good. So I spoke with a lot of my patients and they all were complaining of the same things, fatigue, heavy, bad, painful periods, difficulty going through menopause, weight gain, mood, anxiety stuff. So it was like a broken record every day at the office. And I decided to pivot into functional medicine in 2019. So
Okay. So you're really enjoying it, the functional medicine aspect.
I am. I feel like it's kind of, if I had known about it when I first started in 2007, I think I would have been doing it from the beginning. It just makes sense, right? Why would you isolate one system from the others instead of treating it as a whole body, right?
Right. Makes sense. Yeah. I think functional medicine is going to be kind of the future of how we practice in multiple settings. So,
Right. Like the new norm.
the new norm, hopefully,
Hopefully.
but yeah, we'll see. Pharmaceutical companies have their fingers dipped in everything. So we'll see
Right.
how well
I
that
I
goes.
noticed that. I think, big pharma and, insurance companies, like, you want to keep people sick. So yeah, it can be tough to get
Yeah.
people to change.
Yeah, for sure. So what kind of things were you doing for work, before you really jumped into your own practice?
I was working in aesthetics. And so I actually was a 1099 contractor. So I worked at multiple different med spa type locations. When COVID hit, I think like all of us in the healthcare field, a lot of people either changed careers or they pivoted, right? And I just remember feeling like very concerned because obviously you can't do Botox or filler or lasers on somebody during COVID, right? And so I luckily was at a practice that was more of an integrative practice at the time. So I was doing the aesthetics they added, but I was also learning how to balance hormones and do like thyroid balancing and some peptide therapy.
Okay.
Yeah,
And
so
s-
that's kind of how I got into doing functional medicine was by that happened. And then I said, well, I think that I really want to do this. I love that I can help people, but also I think it's a more practical thing. If I want to do telemedicine visits or things like that, I could actually do it. And so
got
I just, yeah, went from
Gotcha.
there.
Gotcha. That makes sense. Yeah. Yeah. I think a lot of people pivoted from procedural stuff during COVID to more telemedicine based things and
Sure.
laboratory medicine. Yeah. Um,
Right.
okay, cool. So you started your practice 2 or 3 years ago. So
Mhm.
walk me through that. How did you start and how has the trajectory of your business been going?
So I I'll be honest, I recommend that people do a lot of planning. I didn't because I think no one planned for COVID, obviously, right? So it just kind of fell in my lap. Like I said, I was working at this integrative practice and I was learning a lot. And a massage therapist I knew said, hey, I have an opening in my office. You know, would you want it? I know you're starting to do functional medicine. And I just felt like it was one of those things where it was just like, okay, I think this is time because here this is falling in my lap. And yeah, I don't know. That's how it started. So
Sure.
I just took this lease on. It was difficult because I think, Justin, nurse practitioners don't get any business training unless they were trained in business prior to choosing this as a career, right?
Right.
So, that was the hardest part for me. I actually got the lease July 2020. I really didn't even start seeing functional med patients till spring of 2021. I mean, it took me so long to get all the permits, especially because it was during COVID. So to get all the permits and get my EMR, everything set up, it was a lot of work. Um,
Yeah.
and so, again, I think the business aspect was the biggest struggle for me. How do I price? I mean, I knew I've been a nurse practitioner for a long time. But it was how do I price? How do I package things? So that I see repeat clients. I think that's the thing is if you're going to run your own practice, you want to know about how many patients you're going to have every month, right?
Right.
And if you don't, it's kind of just like, oh, how many will I get this month? Or so.
Well, the thing is, projections, you can
Mhm.
always do, I mean, you can always do educated projections, but
Right.
You know, I mean, at the end of the day, I don't know. I've always found it to be kind of a waste of time. I mean, it's a good idea to kind of be, go into starting a business with realistic expectations, being very conservative with it. Like what's my break
Right.
even number, and is that break even number? Does that break even number make sense? Like, if my break even number is only 10 or 15 patients a month, then it's really not that big of a deal, right? But if my break even
Right.
number is 100 patients a month, that might be a problem.
It might be a
So,
problem. Well, and I
yeah.
think, my idea for the practice was always the no debt startup. I
Yeah.
think to be honest, it was a combination of COVID happened coupled with the fact that I was working as an aesthetic injector, and here in Florida, the pay is crap. It was $50 an hour. And I thought, well, geez, I kind of just want to replace my daily salary. If I work for 8 hours, that's like $400 a day. So for me, I was like, if I'm making $400 a day, I'm good. Let me
Yeah.
see if I can get to that. And so, because I was working for someone else when I started it, I didn't have the pressure to have it like be perfect and have all these projections. So for me, that worked. I know that's not everyone can't do that because they might have to work full time, but I was able to work part time and start building the practice.
Well,
So,
that's exactly what you want to do though,
okay.
Right. Like, I mean, no, you did
I
the
mean, it
exact
seemed to make sense to me. Uh,
right. Well, yeah, I mean, I think it's just common sense, financial
yeah.
common sense, right?
Mhm.
That's why I put it in like, the elite NP model that I made, part-time practice, part-time business, part-time job. Like that's what you
Sure.
want. That's how you want to do it. You avoid getting into debt, exactly like how you did it. You want
Yeah,
to avoid debt at all possible,
I
especially
think so
business debt.
too.
Yeah,
Yep.
yeah. Especially business debt. You don't want to take out a big loan to start your own practice. It's not
No.
necessary.
I don't think so. I think, a lady that I first worked with, she had a huge med spa down in Sarasota, and she's about, I'd say probably 15 years older than me. And that was her advice to me was, hey, don't ever buy anything you can't pay cash for.
Yep, 100%. If you can't pay
Yep.
cash for it, you don't need it. You don't
You
need it
don't
in your
need it.
business.
Nope.
Right.
And
Yeah.
I think there's just a lot you really don't need if you really get down to it. And that's exactly how I ran. I did full script for supplements for a really long time. I still use it. Um, I only keep in stock what I know people usually get on their first or second visit. Most of them want to do telemed after just because, everybody's busy these days. So
Right. Yeah, you don't need a bunch
yeah,
of people coming into your office every time they visit. It's not necessary. First time visit, I
no,
think it's good to be in person, and then after that, it's phone calls.
exactly. I
Yeah.
think people appreciate that. They might not have time to come in because they don't have the time to commute, but they do
Right.
have the time to talk. So yeah, I think everything grows. I think in the beginning you are slower because you're learning your protocols. I did have the good fortune, of course, of being trained in like pellets and hormone therapy prior to opening. So I definitely wasn't starting that out blind. But the business aspect of that was definitely a second job, basically.
Sure.
So
Sure. Sure. Um, okay, well, congratulations. You started your practice. You were able to avoid debt. I'm sure you worked your ass off, working part-time, getting your business
I
up and
do.
running.
Yeah.
Yeah, yeah. It's a
Still
sacrifice,
doing.
right? Yeah, still doing it. Yeah. Yeah, that's just
Right.
a sacrifice you got to make if you don't want to take any kind of debt. Like you're gonna
Right.
work hard. You're just going to,
And I think
but
it's worth it.
it's
I mean,
totally
for
worth it.
me, it has been, now I think I'm at the point where I'm like, hey, I'm now starting to get pretty busy. I've hired on a virtual assistant. And I'm actually going to take a little break in September and not take any new clients, put them on a wait list because I really want to just kind of redo how I package and price things.
Sure.
I think that's for me, that's been the hardest thing, right? Is just how do I package? How do I price? I think when you first start, especially functional medicine, it's such a big field, you kind of take the patients that come to you and find you. And as you keep doing it, then you realize, hey, I'm really good at these things. I have a passion for these things, and that's what I'm going to focus on. And so that's kind of where I am right now.
Yeah.
It's
Yeah.
just
Okay.
narrowing it down.
Narrowing it down. Okay.
Mhm.
So what do you offer today?
So, generally speaking, what I mostly see, I have about 80% women, 20% men. So I would say hormone balancing, weight loss, and my general functional medicine. I tend to see most women coming in, menopausal relief, people who have like heavy, painful periods, or they want to get off of birth control. I do see a lot of people for fatigue as well. That's probably one of my biggest complaints. I see people coming in is they're tired
Okay.
and can't lose weight. So
Yeah.
it's
Yeah.
pretty common, I think, in any.
So rate the services, just off the top of your head, just estimate it here. Rank the services based off of, what's the number one service that you're providing, and then kind of just go down the list here. So that way we can kind of narrow down here what you really should be focusing on.
Right. So I think the number one service would be hormone balancing. I especially
Okay.
prefer pellets. So
Okay.
hormone balancing, weight loss, and I call it general functional medicine. But
Okay.
again, usually those folks are coming in. I do see a lot of Hashimoto's thyroid. And so I'm going to be changing and having a program. So, I do a variety of tests when people come in, Justin. I might do like 25 tests, blood work tests, and then I can kind of get a good picture of what's going on inside. And then
Okay.
usually pair off as to, hey, is it detoxification we're working on with this person? Is it reducing inflammation? I would say my functional medicine practice is number one, reducing inflammation, number two, increasing detoxification, and then all the little steps in between, right? If
Gotcha.
you wanted me
So
to really narrow it down,
yeah. So most patients coming in, then you do basically the same kind of functional medicine approached lab work on them for weight loss,
I
HRT,
do.
whatever. That way you have a good
Yep.
understanding of where they're at.
Exactly.
Yeah. Yeah.
Exactly. And then, I might find out on their labs, hey, this person has Hashimoto's. So it's like, having a Hashimoto's program where they get weekly emails and they have a specific protocol. Of course, I do all this the same, but I haven't really written it down. And so, I think just making a more concise program that's more clear, for that and for fatigue. Those are, kind of what I'm looking at doing.
Okay. So do you want to continue doing just like basic hormone replacement therapy and weight loss, or do you want this practice to pivot to more of a functional medicine practice?
No, I want to continue the weight loss and hormone balancing. I really find that most people that have found themselves in this situation of weight gain, struggling with weight and or hormonal imbalance, it's multifaceted, right? So they're undoubtedly also a functional medicine patient. I would say there's a good majority of my patients that do really well right off the bat with hormone therapy, but all of them could be improved. And so it's like it's really great to help them with the hormone balancing, and then we pick off little things that can make them feel better. So yeah,
Got
so I'll totally keep those.
Yeah. Okay. Gotcha. So weight loss, functional medicine, HRT is basically what you're focusing
Mhm.
in on. Yeah. Okay.
It is, yeah.
So, okay. So are you branded as a functional medicine practice?
I am, and actually that was the
Okay.
one thing I actually started with School of Applied Functional Medicine back in 2019. So I've taken 2 semesters with them and I have passed both of those semester courses. I haven't certified yet, but yes, I I am definitely functional medicine for sure.
Yeah. Yeah. So that's your practice, the functional medicine
It is,
practice.
and that's how I differentiate my weight loss and my hormone therapy as well. And I lose some weight loss patients because, they just want someone who's gonna prescribe them tirzepatide or semaglutide, whereas I'm like, "Hey, listen, wait, I gotta get labs, I gotta check you out. I don't wanna waste your time." You know what I mean? So specific
Right. You're not,
individuals. Yeah,
yeah. Yeah. You're not
yep,
operating just a pill mill kind of a thing. Like, here's your
correct.
semaglutide, do some blood work, see you in a month. Right.
Right,
Yeah,
exactly.
yeah.
Yep.
There's nothing wrong with that model. That's
No,
just
if that's what
that's
you
the
do,
right.
sure.
If that's what you do, that's what you do, right? Yeah, but you're looking at this more from a holistic standpoint. So that's
I
your
am, yeah, I'm trying to fix their root causes so that they don't gain the weight back.
right, right,
And
right.
so we work a lot with that. We talk about, all your stuff, your, different, changing diet, changing lifestyle, cutting out triggers and things like that. So it's definitely a little different in that regard for sure.
Yeah, yeah. Okay. So what do you need help with here? So you want to create packages, repackage things. Like, what exactly are you needing help with here? Now that I have a
That's
good
no,
understanding of what your
that's
practice is.
that's exactly what it is. So if somebody were to come into the practice as a functional medicine patient, they would get put down certain pathways, whether it were the Hashimoto's or fatigue. And I would basically start advertising that, hey, these are the services I work on. So, having a fatigue relief program, Hashimoto's reboot program or thyroid reboot program, it's going to be presented in that way. So I'm really, not selling services. I'm making solutions for people's problems, right? And so I want them to be able to clearly come to my website and go, "Oh, I have all of these symptoms. I should really go get this testing and become a new patient because I might have this because I have fatigue, right?"
Right. Okay.
And so, you know, instead of people coming to me with all kinds of crazy stuff, it's like, "Hey, wait a second. Let's check you out. I focus on treating people with thyroid issues, with fatigue, heavy periods or things like this. That's basically what I'm doing over the next month is just saying I will or won't treat. I don't treat mold. I don't treat Lyme disease. I already know that. You know what I mean? But people come with some interesting stuff at me, and I have to just really uh, narrow it down.
Gotcha. So how are you wanting to present this though? It's like I like
How do I want to present it? Yeah.
yeah, I'm thinking to myself here, like you have a website, most people
Right.
are going to find you through your website, and it's something like, y- do you have weight problems? Do you have,
Right.
hormonal issues, perimenopause, hot flashes, whatever? Do you have fatigue? Do you have this? Do you have that? Like,
Right.
if I was to present this on my site, because I mean, this is very broad stuff. Like everything you're telling me here, it's like, it's
It's kind of
really
broad.
hard. Yeah, it's hard to market a lot of this specific stuff. And
I think fatigue is a big problem for people, and so it's
yeah,
like, I think that, possibly having a quiz embedded, so if people come for fatigue, like using SEO and keywords and things like that, for the different sections of the website, when
for
someone
sure.
comes up to it, if they have fatigue, maybe it has a very brief description of, "Do you have any of the following symptoms? We offer a fatigue relief program.
Right.
Take this quiz and see if it's something you should look into," whatever, have them take the quiz, um, talk about thyroid issues and things like that. Most people are pretty intuitive about their own health and their own body. Sometimes they try to ignore it, but you almost never hear a story of, oh, their provider wanted them to do all this stuff and they didn't. Usually it's the story of, hey, I've thought something's been wrong for years. Right.
Right. Right.
I
Right.
mean,
Right.
every single person in here that has Hashimoto's, thyroiditis on their labs, they have said to me in that initial message for a new appointment is, all the typical symptoms of it. Plus, a lot of them will even say, oh, I've thought I've had thyroid problems for years when I ask them that. I ask them in their interview before I tell them their lab, hey, have you ever been told you have thyroid problems? Well, no, but it's always borderline, or I have all the symptoms of it, but all my labs always come back normal, right? I mean, I'm sure you've heard that a bunch of times.
Right. Right.
So people are starting to search for things. I think our patient population is becoming more knowledgeable, more empowered.
Sure.
So I know most of my patients because I ask them, hey, how did you find us? Was it a referral or what? And most of them are like, hey, I searched functional medicine and you came up, or I've been having these symptoms and I've been searching around and your practice came up.
Yeah.
So
Yeah.
they're
So yeah,
already looking for somebody like me.
right, exactly. They're already looking for you. Right. So
Mhm.
my suggestion would be like on your homepage is to list out, those questions. Do you suffer from weight? Do you suffer from fatigue? Do you
Right.
suffer from blah, 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 et cetera, et cetera, et cetera. Like you have to outline their pain points. And then at the end of those, each one of those questions, basically just say, we treat this, click here. And then on that
Right.
page, you do exactly what you just said. You go over the symptoms, you go over how you treat it. You have them take a quiz, whatever. You have articles on there about those kinds of things. If you just do just simple things like that on setting up
Right.
a website, you're going to get so much traction, right? So just,
So
yeah, I think so.
I'll let you
So
know.
yeah, yeah, I think you will. So I think that you just need to narrow down, you don't want to do it sounds like you don't want to treat everything with functional medicine.
No,
So
I think, what is it? Jack of all trades, master of none or whatever. It's like
right.
I want to be known for these certain things, and be able to treat that. And I know, like, I don't think I said this, but one of my other things I really have gotten good at doing, I really like doing is like GI map gut health. So doing personalized gut heals. I've taken a lot of training on that. And so, I think that like you said, just narrowing that website down, listing out what it is that their problem is. I'm in the process of creating some like free stuff too, as far as like, top 3 supplements for inflammation, or, just free little guides that people can download and have sent to them. I think people like that. And so they can kind of see a little bit more what you're about.
Yeah. No,
Um,
no, I think it's a good idea.
that type of stuff. Yeah.
Yeah. So I would just try to keep it to, between 6 to 8 things. Anything more,
Right.
you just start confusing people.
I
So,
think I was thinking like 3 to 5. So
yeah.
that's what I'm really narrowing down. I think that's the hardest thing is like, oh geez. So it's like I said, I do weight loss, I do the BHRT. And so, there's probably a couple other things that I'll do and that's it.
Yeah. Yeah, don't throw away the weight loss and the hormone replacement therapy. I mean, that's a
No, I
significant
think they
revenue
go so
stream.
well. They go
Yeah.
so well with what I do, and I've been really happy. I love to help those people. They really do well with the functional medicine approach. So
Yeah. No, for sure. Um, so you have any other questions about repackaging this stuff? I mean, it sounds like you're on the right path here.
going on the right path. I think it's just me with my ADHD narrowing down. I think
Yeah.
that's the hardest part is like, okay, you can't do because I'll be like, oh, let me just add that one. And then I'm like, wait, no, no, no.
Pick the 3 or 4 things that you
Mhm.
are good at,
Right.
okay, and just stick to that. You can't start deviating here and
No.
start treating everyone for everything. You can't be everything for
Correct.
everyone. You just can't. So pick the 3 or 4 things and call it a day. At my men's health practice, we do testosterone replacement therapy.
Mm.
You come in here wanting all this other stuff done. We don't do that. I'm sorry.
Right.
Like, sorry.
But
That's just,
no, and I think that's awesome because it's like I said, I didn't start out my practice as just only HRT, right? And so I think that's what happens to me right now with the functional medicine is people come in with all this off the wall stuff, and then I'm taking so much extra time to treat them. It doesn't make financial sense for the practice because I'm spread so thin. To whereas if I said, hey, this is what I treat. If you have these symptoms, come and see me. I have protocols which can be tweaked if you need it tweaked for your personalization. But for the most part, this is going to be the cost per month. This is going to be how long the program is. This is what it consists of, right? So
Right.
people know what they're getting into. I think
Right.
it makes more sense,
No, I
you
think it
know?
does too.
Yeah.
Say that this is our fatigue protocol. This is our
Yeah.
inflammation protocol. This is our Hashimoto's protocol. Whatever it is that you decide to do, outline those things and call it a day. Have a separate page for HRT. Have a
Sure.
separate weight loss because you're going to get people wanting that kind of thing too, and it brings revenue into your practice, right?
No,
So
it does for sure.
yeah, yeah. So I would just narrow it down like that. So you have HRT and weight loss. That's two things, right? And then
Right.
3 to 4 functional medicine conditions that you really focus on. And then like that's all I would list on the site and call it that.
Right.
Is people calling you for a bunch of other things like, sorry,
We just don't do that.
we just don't do that. We don't specialize in that. Now, if you want to come in for a robust initial lab work evaluation, see if we can find any root causes that we do focus on, you're more than welcome to. You can come in, this is the price, whatever. You can do that so you
Right.
don't just turn someone away.
But if it's
But
not something I treat, then it's not something.
right, right. Someone wanting
Right.
to call with cancer and they want a functional medicine approach to
Oh,
treatment
geez.
for
Yeah.
it. Like,
You have to draw the
no,
line somewhere.
you just draw the line, right?
Mhm.
Exactly.
No,
Yeah.
and I do, I've told people, and, I recently hired an esthetician, just because I felt like a lot of people want more like green products. And so we focus on just doing like, or she focuses on doing like botanically based facials with some medical grade products, so that was just kind of a way of having someone else on board so that I wasn't always doing all the revenue generating.
Now, let me
And
ask you here, though. You're saying that you want to focus on some things, and how does an esthetician fall into this? This is aesthetic. Like, how does that fall into it?
yeah, so and I was gonna say, I have a bunch of aesthetics patients that I've kept it from doing Botox before, and so I just kinda treat those patients, but yeah, it was, so I would get a decent amount. That this is where it all gets kinda crazy, as I would get a decent amount of clients that, wanted, help with, like, acne, rosacea, psoriasis, all that kinda stuff, and so I think a lot of people wanted, like, more of a green, like, holistic type, facials and stuff like that. And so now that she's here, I'm kind of like, oh, geez, I'm switching all this stuff. So it's like, how does she kind of fit? But I think she does because, I really focus on people having like toxin free options. That's a lot of what we talk about in their programs. And so I think having someone here that can offer services to them that they would want without using toxins, I think is helpful.
Okay.
Um,
So, if someone calls you saying they want aesthetics or whatever, even though this isn't really listed on your site, what do you say?
Yeah, and that was the thing. I think that's been the hardest part for me is kind of letting go of the aesthetics because 'cause I've done it for so long. I have a decent amount of loyal, to support customers and, microneedling and stuff like that. So I don't know is the answer.
Okay. Yeah. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
That
I
was
have this feeling it's going to be very hard for you to really stick to one narrowed thing. You know what I mean?
right.
Because you're doing so much here. Um,
Yeah.
and
No, and that's why I said I
I'm
do need to
confused.
change it and
I'm
focus.
confused. Okay, I'm confused.
Go
Like,
ahead.
what is it that you're doing here exactly? Like, so if I'm confused talking with you here, I can't imagine what
Right.
people landing on your website or calling are going to think. Okay,
Yeah, so I basically only offer the aesthetics to my own clients. So it's like I don't really advertise it much. I've just had clients from my old days doing aesthetics
sure.
and I just kind of kept them. Does that make
So
sense?
yeah, that's
So I
that's
just kind of
that's fine,
I just
but
kind of do it.
yeah, how often do they tell their friends or whatever? Like,
You know, I don't really look at it as like I wasn't really looking to build that side of the practice because I had enough steady people that I just continue to do their treatments. And it's nice for me because it's, an easy thing I can do very quickly and easily. Their treatments are the same every time and stuff like that. So I've just kind of kept it that way for them. And I focus, like I said, I focused more of my practice on the functional medicine. I think
Mhm.
especially when I first started, I was doing more aesthetics because that's what I had done before. Does that make sense? And
Sure,
so I
of
guess I'm
course.
trying to kind of
Okay, I'm gonna I'm gonna narrow this down real quick. What
yes.
is your goal here? Two goals. Pick one. Is
Okay.
your is it revenue or is it like functional medicine? Like what's your goal here with this business?
I think the goal for me would be revenue. I want to
Okay.
have more
Okay.
free time, more balance. So that's why I said I just need to focus and I need to really
Right.
um,
So what
cut a
right
lot of
now?
stuff out.
Yeah, absolutely. What right now? What's driving revenue in your business right now,
I mean, if
today?
I think the functional medicine patients are probably my largest percentage of people, um, along
And
with like weight loss and hormone therapy.
well, that's pretty much your entire practice. I'm talking. We got to be
Okay.
specific here,
So
okay?
okay, specific.
What's
So I would
driving
say
what's driving revenue right now today? Semaglutide, testosterone, estrogen. What is it that
I would say
you're
like
making money on?
I think my functional medicine patients are probably starting to take over. Um,
Okay.
I think because I'm in Florida, Justin, so I think there's a lot of like pellets out there, a lot of
Oh yeah,
HRT
it's
clinics.
it's saturated. It's all to all hell in
Right.
Florida. Yeah.
Right. And so for me, I'm really starting to notice the functional medicine side pick up.
Okay.
And so I guess I guess what helps for me is that I convert people because they undoubtedly a lot of them have hormonal imbalance and that's where they come for functional medicine. So we treat the root causes, but a lot of them end up on my HRT program and or my weight loss.
Sure, that's
So
fine.
does
That's
that make
fine.
sense? Like
Yes, absolutely. For
I think
sure.
I'm starting to I think I think if I had to pick the one that would be functional medicine patients,
Yeah, okay. So
for sure.
that's yeah, okay. So that's where you want your focus and that's what
Right.
is taking over in terms of your revenue goes. That
Yes.
is your focus.
Right.
Yeah, that's what you make your website focused on. This aesthetic stuff on the side that you're doing, fine, whatever. It's you're making some money on it. Okay,
Right.
great. But no new clients for that. Like you focus in on this functional medicine, and that's what
Right.
your website's about, nothing else.
Correct.
Okay. Yeah.
Correct.
Right. So, yeah. So you have a
That's the
functional
plan.
medicine practice. Okay, good. All right. Of course, you can do other things inside of it. Like with my men's health practice, I do a couple things that I don't even advertise on my website just because
Right.
it's
But
applicable to
like
this
your clients know
patient.
you do it.
Right. Exactly. It's applicable to this
That's
patient
kind of
and
how,
whatnot.
yes.
Yeah.
But
Yeah.
yeah, my
Okay.
main focus is the functional medicine, developing those, like we talked about, those limited services with that. And then, I think for me, I've noticed that advertising, especially down here for BHRT or for weight loss, these places are a dime a dozen. Word of mouth has been the best thing for me. And so again, I think I'm generally getting those functional medicine patients that convert to weight loss and hormones because they like me and it's
Sure. Of
part of
course.
their
Why not?
program. Does
Yeah.
that make
Right.
sense? Like, they'd rather
Right.
just see me and have everything done at one place, and I kinda do a holistic, like, whole body type thing, and, they feel a lot better.
Yeah. It's a
And then
complimentary
they stay
service.
for pellets or HRT or, um, weight loss, you know?
Sure. Yeah. 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 It's a complimentary service. It makes sense.
Correct.
So your packages here, it sounded like you wanted some help creating packages. Like, I feel like that you should just have some base rate,
Okay.
just a base rate, and then everything else is just an a la carte kind of a thing, added to it.
Okay.
So, you know, how much how much are you charging right now for functional medicine? Like just in general, just a general
So,
functional medicine appointment.
they have an hour appointment with me, and that right now is 250, and then if they cash pay their labs, it's 300, and they get about 25 tests.
Okay. And then from there, if you prescribe them HRT or whatever, then there's additional add-on fee to it that you would charge them for the HRT through a compounding pharmacy or whatever.
That's correct.
Yeah.
So,
Okay.
and that was one of the things I had, I offer creams and injectables as well as pellets. And I was looking at that at possibly just only doing pellets, just because I feel like that's my preferred method.
Sure.
Um, and I know we all have our different ones, right? Um, but I think right now I was just doing, their visits, and I was letting them pay for their medicine from the pharmacy. And I think, if I'm going to be doing the injectables, it needs to be I changed it to 139 a month for men and women, and that just includes, any contact with me as well as their injection supplies and medication. Um, and then they have to just do labs, at certain periods
Separate
of.
or whatever. Yeah,
And so, right, if they have insurance, I don't know if you let your patients use insurance for their labs.
I do.
Um, I do. I think it's nice to help save them money if I can.
Sure. Why not?
Um,
Exactly.
so I do that, or I have cash pay if theirs is too expensive.
Right.
So that's
Right.
kind of how I was doing it. Um, and pellets are just, obviously you pay per, it's a fee per service, right? So I never like to lock people into multiple. Now, if people like me and I know they're going to keep coming back, I might say, hey, you get X price if you buy for the year. You can do that. But most of my people are doing stuff like as they need it for pellets.
Yeah.
And I told you asked about functional medicine. I told you that price too. So
Yeah. Yeah. Okay. So, I mean, I think that's reasonable, and then just anything else, any kind of medication or whatever that you add on top of that $139 a month charge,
right.
I would just do it through a compounding pharmacy and just mark it up, 1.5 or 2x or something. You don't have to mark it up
Right.
significant,
And I think
that.
that's what's hard. Like, do you prescribe peptides at all, Justin?
Yeah.
You do? I look at the risk involved just because a lot of them aren't FDA approved. And I think that's where I think, geez, how do you charge enough to make it worth your risk or time?
Yeah.
And
Yeah.
then
The
then they'll
risk.
actually be able to afford to buy it, right?
I've
And
never, I've never in 4 years had anyone have any kind of significant adverse event to a peptide.
I know
Okay. Like,
that's the crazy part, right? Is they're so good
yeah,
for you.
they're safe, yeah.
I think so
I
too.
I'm not concerned about that. So, we charge about 2x on peptides. Okay.
Okay.
So something costs us $100, we're going to charge them $200 for it. Okay.
Right. So if you're doing you know, if you're doing like BPC 157 and it's about 150, you're charging like 300,
Yeah. About $300. Correct.
then you just do that per month. Now, do you ever lower your price? Like if they're already doing like TRT and you say, hey, normally it would be 300, it's 250 for
Yeah,
you.
so
TRT.
right. So if they have a baseline service like TRT, for example, our baseline service for TRT is about $140 a month, right? And that's
Okay.
testosterone and the visits and
Yeah.
and the supplies. So if they want peptide on top of that, then yeah, we'll usually give them a little bit of a discount on it. So instead of 2x, it might be 1.5x. If
Okay.
someone's coming in for peptides alone, then it's 2x. So yeah,
Sure.
and it's a little case by case basis for some people. Like, if I've had a guy who's been with me for 3 years, I might upcharge the peptide $20 or something, like this
I was
guy's
just gonna
getting,
say people who are like consistently,
yeah, that's
consistently patients, I've had patients for 3 or 4 years. It's like I try to give them a deal when I can because I know they're already doing
exactly,
X amount
exactly,
of services for me.
exactly. Right,
Right.
right. It's a case by case thing, and then there's some patients who are brand new to you. Yeah, charge them the full amount.
Okay. That makes sense.
Yeah, that's what I do. So I mean, your pricing structure sounds pretty reasonable here too. That's pretty affordable. 200, $250 for the initial appointment, then $140 a month. That's really reasonable, and it generates that $110 a month profit per patient per month. That's solid. You could probably get away with paying, charging a little bit more if you wanted to. Um, so yeah, no, I think that's pretty good. I think that you just need to narrow it down to, what services that you really want to specialize on your website. And the thing with functional medicine is it's case by case. It's so hard to narrow down. I'm only going to treat these three things when you do a comprehensive lab panel on someone and they have multiple issues.
That's
You're
I was gonna say, I think that's the thing is that, inevitably you're gonna find some interesting stuff, right? And
of
it's
course.
I think that's why I have a hard time because like you said, how do you really
So
narrow it down, right?
right. Well, that's a case by case basis with each patient, but from an outside perspective for people, marketing it on your website, what it is that you're actually doing for people, right? Just list out the few most common things that you see that you like to treat, put that on your website and call it a day. you know? And then if you start seeing more common things that you really like, treating, then just create another, create a new page on your site and add it, but just stick to the fatigue, the Hashimoto's, the inflammation, whatever it is that you want to do,
Yeah.
and just leave it at that, you
Sure.
know?
Right,
Yeah.
because when they come in, like you said, they're gonna have different stuff, and I think at that point, if they need a peptide, then you have that, "Hey, well, we do offer peptides, and this is the price per month, in this program," or whatever, right?
Right,
You can just
exactly.
add it.
Yeah,
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 that makes
exactly. But
sense.
if people are finding you for functional medicine, leave it at the functional medicine component of it.
I think you're
Everything
right.
else, yeah, everything else is just add-ons to it. You know what I mean? You
Right.
don't really need to
So
advertise it.
right, so leave it at that and just do their full workup, and then see what's what with that, and then put them down a pathway with their pricing.
Exactly.
Yeah, that makes
Yeah,
sense.
just leave it at that. Keep it, try to keep this simple. There's no reason to complicate it.
No, there isn't, but I think sometimes we tend to when we have so much going on. It's like,
Yeah,
what do they say? Like seeing the forest through the trees or whatever.
yeah,
It's like we're seeing, yeah, you know what I mean?
yeah,
It's like you got so much going on. It's like, how do I really truly focus and narrow down and kind of turn off the noise, so to speak?
yeah, absolutely. You can't build multiple bridges at one time. You got to keep this,
Bridge.
only one bridge, like, you know what I mean? Focus on this
Yeah,
one thing and leave it at that. Yeah, I think
right.
if you start doing way too much, you're overcomplicating stuff.
I
So,
think so. Yep.
yeah,
So,
yeah.
but I feel like a lot of people, I'm sure you talked to a lot of entrepreneurs. Is that a common thing?
Oh, probably one of the most common problems amongst entrepreneurs.
Yeah.
They're just doing too
We're
much stuff.
entrepreneurial.
Yeah, shiny object syndrome. You just want to do all this shit and you just can't focus.
Right.
The whole squirrel thing, right? Like just you
Right.
got
Right.
focus on one thing, call it a day. I mean, if you're generating revenue from it, there's no reason to do a
Mhm.
bunch of other stuff until you get to a point where you can just do it on autopilot anymore. It's like it's knowing the back of your
Right.
hand, then you can start focusing on something else. But
And that's why I said I still do the aesthetics for my patients that ask or for current patients because it is on autopilot. I've done it for a number of years and it's very easy just to do it.
sure.
But I don't advertise because I don't want to overwhelm myself
Right,
with
exactly. So
with
just
it.
yeah, to establish patience, that's fine. Like
Exactly.
I'll do, I'll do a shoulder or a knee injection, a little dexamethasone, little lidocaine or
Sure.
whatever. I don't advertise that, but I'll do it
Right.
for a couple patients, if their
Because you know it would
shoulder's
help
killing
them.
them.
And
Right,
sure.
exactly. Right.
Yeah. No,
Yeah.
that's exactly what I'm saying. I kinda keep my little services like that. But yeah, I it 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 is interesting. It's like it does help to talk with another provider though about it because it's like when you're listening to me and I'm hearing what you have to say, I'm like, "Okay, I know this. I just need
Yeah.
to do it."
You know this. Yeah. So
Mhm.
do you have any other questions?
Yeah, no, I mean, I think you've been pretty helpful today.
Yeah. Yeah. I think it sounds like you're doing everything correctly. It really does. I think you just needed some confirmation here. Like
I
it
think
sounds like
so.
yeah. You're obviously doing well, and your functional medicine's growing. So one
It's
thing that I
starting to,
would
yeah.
yeah,
Yep.
one thing I would advise you to do is that the patients that you have, that you're doing maybe just for weight loss or just for HRT, just for aesthetics, keep them. They're bringing in revenue, but really just focusing on the functional medicine and grow that. And then by the time those other people fall off, it's no skin off your back whatsoever, right?
Right.
Yeah.
No, you know what? I think that makes 100% sense, and I think sometimes it's, like, this fear of, like, "Oh, I'm gonna lose a patient, or what if I can't help them?" But then it's, like, I think that's what my whole next month is about, just, like, really targeting things because I'm, like, if I don't ever remove the stuff that isn't working out for me, I can't ever get the stuff that I want, right? So it's, like, I'd rather be less busy for a little while and only take what I want, like what I wanna focus on, you
Right.
know, and grow
Right.
it that way.
Yeah.
Um, so yeah.
Yeah.
Um, I mean, even with, pricing of stuff, I've had people like, "Oh, I can't afford that, that's too expensive," and it's like, "Well, that stinks, but I'm not changing my price because
No.
people that will pay and, I've decided what my time is worth," right?
Exactly. And there's just some people that, I will make an exception every once in a while at my men's health clinic, but overall,
Sure.
this is the price. Sorry. Yeah. Yeah.
Right. No, I think that's the big thing is I have some really loyal clients I've had for a number of years. And like we said earlier, sometimes you make an exception for them because they've given you a lot of business and you want to do right by them and every patient, of course. But yeah, I find that, just narrowing, focusing, and I think there's a lot of time wasters out there, especially in these fields, right? Where you're doing
Oh
your own
yeah,
business and you have to be able to narrow down that and go, okay, this person's really, they're going to waste my time. Um, and I know I'm not like, it's not going to be beneficial to me or the practice to take it on. So you learn to just set boundaries. I think that's the big thing.
absolutely,
And
100%.
that's,
Yep,
but it takes
yep.
a while to figure out what boundaries you want to set, don't you think?
Oh
Because
yeah. It takes a long time to figure that out as a business owner.
right.
Yeah, yeah.
And
Um, yeah, you just need to though. Yeah,
right.
yeah.
For sure.
All right. Well, anyways, I like to end the episode with you asking me a question in terms of just like, personal question or any kind of curiosities you might have ever had for me or anything like that.
Okay. Um, so how long I guess I'm looking because I've taken a couple of your courses. I found them really good. But how long did you practice for, slash what was like the motivation for you starting your own practice?
I practiced for, let's see here. So 2013, 2012, 2013 is really when I started practicing as an NP.
Okay.
So I practiced for about 4 years, 4 or 5 years before I just got fed up with basically just working for other people and making other people a shit ton of money. Like,
Sure.
I saw the
Yeah.
numbers. I remember
Right.
sometimes working in the ER. Like I would look at my RVU report on how many RVUs I would produce
Mhm.
in 1 month at the ER. I'm like, that is an absolute insane amount of productivity. I've made these people this month alone easily 150, two hundred fifty thousand
And then you don't
dollars,
ever get like a bonus or like
and I was
anything,
getting,
right?
yeah, I was getting paid a
You just get
whopping
more work.
$65 an hour. Thank you.
Mhm.
Wow. So generous. You gave me
Yeah.
$65 an hour. You paid me, $8,000 this month, and I produced $250,000 for you. This is
Right. It's
bullshit.
insane.
Yeah. Yeah.
Yeah.
I got sick of it. I mean, it was just it was just a gut punch to my soul. You know what I mean? I just couldn't do it
Oh, of
anymore. It was
course.
making me miserable. Yeah.
Don't you think it's like it's like you always want to feel like you're being paid, but more importantly than that, it's like that sense of value because you get that feeling of like, hey, I really don't even matter to you. I'm just like a warm body, right?
Yeah.
No, even though you work hard and you're intelligent and maybe you went above and beyond, I always felt like I never got that respect or that, hey, I actually value you as a person and what you're doing here, right?
No, never really. Just a pat
You
on the
never
back from
get
the
that
medical
feeling.
director. Yeah. Thanks for your hard work. Uh huh. Yeah.
Nor do
Yeah.
you get the compensation, and, I think when I was working for someone else, I wasn't asking for even 50 or 75% of the profit. I was just saying, "Hey, if I just made you a couple grand in an hour, please don't pay me $50 an hour.
Right. It's
Give
ridiculous.
me some kind of commission
Right.
for the time I've spent," right?
Right, right. I agree.
Yeah,
So if you ever hire a nurse practitioner at your practice, make sure you compensate them well. You know?
exactly. I think that's a huge, yep, yep.
Yep.
I
That's
I
what
I
I do.
certainly would. And
Yep.
now, how did you decide to do, I guess it's kind of broad, but when you were choosing to do your HRT clinic, what was the one thing that made you choose HRT over anything else you could have done?
Yeah. I mean, I think one of the big things was that no one else was doing it.
Oh,
Like
right.
there was
Back in
no
the
other,
day.
yeah, there was no other men's health clinic in my city. None, zero. No
And
one was
where are
doing
you
it.
located?
In the Southwest. So,
Okay,
anyways, yeah, yeah, yeah. No one was doing it. Like
sure.
nobody. And I was like, well, I'll open up a men's health clinic here then. Like, and
And
yeah.
and so you continued working, in the ER, you're building your business and,
Yeah, ER urgent care, correct. Yeah, I was doing that and then, built the business up. I did the exact same thing you did. I was working part-time and starting my business part-time. And then eventually got to a point where my business was making a lot more money than I could possibly make at my job. And I was like, screw this. I left.
done. Well, did you find when you first started with the HRT that finding training that really led you to be able to use protocols and like actually use the information? Did you feel like back then it was kind of difficult to find that? Because I mean, I started my hormone kind of training in like 2019, I think. And I remember
Uh
thinking then, which is only 4 years, that there was just a lot of like,
yeah, back in 2018, 2019. Yeah, I think it was a little bit more difficult to get training. Yeah.
mhm,
It was just a lot of reading guidelines, listening to various
Right.
podcasts, talking with some people who were doing it. And
Right.
yeah, that's kind of just how it goes. So, your license gives you the power to do it.
Of
And it's
course.
not that difficult of a thing to learn. It's just where do you get the information to learn it? Once you got it, you
Right.
got it. It's not hard.
Sure. And did you find that, that the nurse practitioners or whoever you spoke with when you first started, do you feel like they were pretty helpful to you, or was it kind of tough to find people that would share? Because I know down here in Florida, as we both said, things are real saturated, and um, it took me a while to kind of find a place that was willing to train and kind of
Yeah, I didn't really go anywhere to train. It was more or less just talking with people. Like I knew
okay,
I had a couple doctor friends who were doing it, and so they kind of helped me
gotcha.
out. Yeah, it was mostly phone
That's
calls and stuff. They would just kind of walk me through it and everything, and then
sure.
guidelines, and I was
But I
listening to
think
some
that's the most
podcasts.
helpful training, right? Is like real world. This is how you write it. This is how you do it.
Absolutely. Right, right. And I determined that it was a low liability service. And I determined that as long as I know of the few, know the red flags, know those red
Sure.
flags, know when to refer out, and the rest is gravy. It's not that hard.
Again, I think
So,
we just have to simplify, right? It's like we
yeah,
make it a little more complicated than it is.
right, right,
But at the
right.
end of the day, it really is like breaking it down like very small things. Like if you just have these things, you're good, right?
Right. Yeah, I will see these patients. These patients I will not see. If I see this red flag in lab work, they're being referred.
This
That's
is
that
exactly what I do. Sure.
That's
Sure.
the end of it. You know, Slam
Right.
dunk 45-year-old with testosterone level of 320, slam dunk patient. No medical history, healthy person.
Mhm.
Like, come on, anyone can treat
You're
that
like, I'll
person.
take that one all day long,
I'll
right?
take that all day long. That's the majority of patients.
Uh-huh.
You
I
know,
think so, yeah.
75-year-old cardiac stents. Lab work looks like crap. A1C is 12. Hell no. Go somewhere else. There's no way I'm touching you. You know what I mean?
Right, exactly. No,
Right.
and
It's
that's
not
that's
hard.
the thing. I've told people no a lot of times.
Yeah, you have to. And those are the boundaries, right?
No, those are the boundaries for sure.
Yeah, yeah, yeah. So, well, listen, this was a great conversation. Thanks for giving me a lot of the insight into your practice. And if you ever want to do a follow up, once you get everything narrowed down here, in, like 6 to 12 months,
Yeah.
just let me
I'll
know.
have to tell you how it goes.
Yeah, for sure.
Sure.
Well, cool.
Thanks for your
Well,
time today. It was
all right,
nice chatting.
all right. You're welcome. It was a pleasure talking with you.
All right, talk to you later.
All right, take
Bye-bye.
care. Bye. All right, hope everyone enjoyed the conversation with Heather. A lot to unpack there. This is the thing. You have to focus in on what it is that you're doing, okay? It's okay doing a lot of various things when you first get started. You need the revenue. You want to use all your skills, that sort of a thing. She's doing HRT. She's doing weight loss. She's doing functional medicine. She's doing aesthetics. She's doing all sorts of different things. While that is good at first, there is going to be a point in your business that you need to stand back and say, okay, what is it that I'm narrowing in on? What is it that's driving revenue into my practice that I enjoy? All right. That's another key point too. You never want to just say, okay, this is bringing in a lot of revenue to my practice, but I hate it. If you go with that service, your business turns into a job that you end up despising. Okay. You do not want to do that. So you got to pick the service that's driving revenue that you enjoy. Okay. Once you do that, you have a business that's, working for you that you enjoy, and it's not even really a job anymore. Okay. So Heather enjoys the functional medicine, and that's where the revenue is going. And so if she focuses on that, she's going to have a business that she loves. She's never going to feel like she has to go to work, right? If aesthetics is something that she enjoys too, she could go down that route, or weight loss or HRT or whatever it is. But always focus in on what it is that's bringing revenue in and what it is that you enjoy. If you do that, you will build a business that you will love. All right. Hope everyone enjoys this episode. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.